The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Brumell, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you on the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' remarkable recovery stories. In today's show, I'll be joined by my American Medicine Today radio co-host, Ethan Euchre, as we interview Larry Jasinski, the CEO of ReWalk, a robotic exoskeleton system that was recently approved by the FDA for home use to help the paralyzed walk again. Next, we'll hear from Missy Radfar, who was suffering nerve damage and pain, which caused her to be unable to work or even perform simple daily tasks, such as driving. She will tell us about her remarkable recovery after receiving the exclusive and patented Bonati spine procedures from Dr. Alfred Bonati. In our final segment, I'll speak with Dr. Bonati about a survey of why many doctors don't like Obamacare. Introducing our first guest is radio program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thank you, Kimberly. Every Saturday at noon, we're joined by interesting guests who shed light on the growing concerns many Americans have about their medical care. The patented Bonati spine procedures are leading the way in minimally invasive spine surgery exclusively performed at the Bonati Spine Institute. Now, a recent 7.5-year survey shows a patient satisfaction rate of 98.75%. Dr. Bonati dramatically changed the way conventional spine surgery is performed. Following in Dr. Bonati's quest to find medical experts who are pushing beyond conventional methods of medical diagnostics and treatment, we are proud to introduce our first guest.
Larry Jasinski, the CEO of ReWalk, a robotic exoskeleton system that was recently approved by the FDA for home use. And this goes to help the paralyzed walk again. We're here via Skype with Larry Jasinski, CEO of ReWalk Robotics, and ReWalk, a personal exoskeleton system that has now been approved by the FDA for home use. And this is so exciting because you're taking people that were paralyzed, either quadriplegics or paraplegics, and you're giving them the instrumentation so that they can walk, they can hold hands, they can be more communicative with their loved ones and in life. Tell us more about the ReWalk.
It is something that was invented by a gentleman who was quadriplegic, and I think that's a very important component because his understanding of how difficult life was for him allowed him to be able to build something, because he was a particularly prolific inventor before he got injured. The product itself, it's the phrase we use is more than walking, because for any of us sitting around, we're used to, gee, it'd be nice to walk again.
Right.
But we don't realize there are a lot of secondary health issues, and whether it's bone loss or problems in the GI tract, GU tract. And what most people who use this device say to us is, look, this improves my health. I like to walk, I like to see people eye to eye, but my metabolism is working better, I am healthier, I am living a better life, in addition to being able to walk.
So, Larry, what is sort of the, I guess, prototypical candidate for a ReWalk? I mean, can you have someone who hasn't walked in decades, or do you need someone who is relatively new, where they still have the bone strength and the muscle mass and things like that? Who's the prototype user for ReWalk?
Well, our users vary a great deal in how they live. We have people as short as 6 months post-injury to 15 years after their injury. There's a few key characteristics. They have to have enough bone density to stand on their own bones again. And if they've been working and standing in standing frames in the time in between, they will have that. They have to have blood pressure such that when they're standing up again, that they'll be able to not faint. Those are the two of the more common ones. The only other limits, there are a few, but it's size. It's 5'2" to 6'2" right now, what we have made, and up to about 220 pounds. And you have to have reasonably good cognitive abilities to pay attention to where you're walking, especially if you're going down the street.
How long does it take somebody to fit the ReWalk?
I'm sorry,
When it fits to their size, is it something that happens pretty quickly?
It does. When you're first setting the system up, you have to set 4 or 5 parameters. The right size foot plate for the foot, you have to make it equal to the length of the tibia and the femur in the middle of the body, and you have to put the right size waistband. And then we set some things on a computer. For most people who buy one to take home, we set all that up the first day, and it takes us about 1 to 2 hours. And then they put it on and off in usually about 10 minutes. In a rehabilitation center, they may use it for different users, so they may have to spend 30 minutes or so configuring it from user to user if they have a different size waist or a different length leg. But generally, it doesn't take long.
Is there a remote for the ReWalk? How do the people move? Is it actually on the exoskeleton, so to speak, or is there a remote that's handheld?
Well, this device, it's a combination man-machine. This is, I don't like to use science fiction analogies. This device won't walk by itself, and the user can't walk by themselves, but when they're together, they can. And it's as simple as, you can't quite see me here, but if you're sitting in a chair, this device works from 2 things beyond the motors and gears. There's a motion sensor that is located just below the left elbow of the individual on the side of the unit. And then there's a software system. So when they lean forward in a chair, for example, that tells the tilt sensor they want to stand. When they want to take a step, as they move their upper body forward, the tilt sensor will tell the computer to tell the device to use. So this is entirely controlled by the person. They can walk right down the street, stop, look in a window, go down to that place. It's a very easy individual device to use.
And what about running, stairs, things like that? Or what are the limitations of the ReWalk?
Right now it's a walking device. It is used in stairs right now in Europe and in Canada. In the United States, we're going to add that on with some more clinical data, but we don't have that today. It is not used for running. It is not designed for that yet. We do have some people that have done events, but they do it in a brisk walk. So we've had some 10Ks done, 6Ks, and one lady that did the London Marathon.
And it was just approved by the FDA for home use. So how soon before we can start seeing it on the market for use among paraplegics?
Right now, it actually had approval. It was approved for the use in the rehab centers because the FDA made this entire category class 2. And it was also approved for use at home. So you can train in a rehab center and then take it home. So it's the only one approved for that in the U.S. now. We have 3 that have been taken home already. One in Long Island, New York, one in Tennessee, one in California, and we expect about another 7 or so will be placed in the short term. So you're going to start seeing it around the streets of your communities, I think, as time goes on.
What does something like the ReWalk cost for home use?
The price is $69,500.
Okay.
And I think it's very important for us to work with the insurance companies and others to look at the value equation. A lot of our clinical data is showing significant medical benefits, and it is our expectation, and we have quite a bit of data that supports it at this point, that this will save money to the healthcare system in the end. It will not be a cost, and that's part of the data we need to expand on to get the insurers to provide this for some. A very important decision just happened a few weeks ago. The James J. Peters VA in the Bronx, New York, made a policy decision to provide this for their users that successfully treat the program. So they are paying for it. They were doing more research than anybody else in the world, and they've done it independent of us. So they understood the device, they understood what it meant, and I think that had a lot to do with them deciding it, along with, frankly, just simply a proper concern for veterans. Just an incredible decision by the VA.
Well, I know with a lot of programs like Wounded Warriors and things like that around the country, I'm sure there's a lot of military veterans that it's certainly going to bring a lot of hope to them. Amazing stuff.
Unbelievable advancement in technology. Congratulations to ReWalk.
Thank you for taking some time. We think it's something that we also want people to know about, and when you see someone down the street, you'll realize, walking up the street, you'll realize what they're able to do now. And we've talked to them eye to eye, and their health is going to be better. It's a great combination.
Absolutely. Larry Jasinski, CEO of ReWalk Robotics. The ReWalk personal exoskeleton system finally cleared by the FDA for home use. It's a pleasure having you. Exciting stuff, Larry.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows a surgeon more access to their patients and allows you to go home the same day. We'll be right back to hear from a Bonati spine procedure recipient in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
Missy Radfar was suffering nerve damage and pain that caused her to be unable to work or perform even the simplest of tasks, such as vacuuming and or driving. Now she'll tell us about her remarkable recovery after receiving the exclusive patented Bonati spine procedures from Dr. Alfred Bonati. We'll also hear from the medical staff that assists Dr. Bonati with these life-changing procedures in our Back to Life segment.
I went to Dr. Bonati's Spine Institute because I have neck problem and headache right after I have my back surgery with the different neurosurgeon. I have numbness in my right leg, and it was suggested to, if I have a surgery, 80% of that numbness is going to go away, which it did. So I was able to walk, stand or stuff. But after that, my neck started, and I thought maybe because after the surgery, the position I have to sit or sleep, it's affect my neck, but it wasn't. But the orthopedic surgeon says nothing they can do except go to the pain management. It's not to the point that needs surgery. So I went through the pain management. I have injection in my neck, my skull, like 10 injections in the total. It helps for maybe a few weeks. And after that, I was back to square one.
Yeah, the fun thing about working here is our patients all get better. When you deal in pain management, which is my specialty here, mainly I'm in, patients a lot of times are on narcotics all their life, they're on pumps, they're on stimulators. We don't get that. Our patients, when they come here a lot of times on heavy duty drugs, and when they leave, they're off those. Or if they come here on a pain pump, by the time that they're done here, the pain pump's turned off. So, you know, you see a patient, and I said this a million times, they have a frown on their face, a furrowed brow when they come in, and when they leave, they've totally done a personality change.
I was written up because of missing too many days of work. So my job was in jeopardy, losing my job because of my absence, not my performance. You know, it's gets you to the point that you drag yourself every day out of bed, but then you cannot finish the day. I have two daughters. One just turned 24. My youngest one, May, turned 21. We couldn't do anything as a family. We couldn't talk, sit down and talk, because I was in pain and impatience, and usually regular conversation end up with the arguments or sort of like disagreements, and it's affect your family life. It's affect your children, your work. You're not able to communicate, or you don't feel like talking to anybody because you're in so much pain every day. That's besides the like normal routine jobs that you have to fulfill. It makes you very feel useless. My experience, the first day I had an appointment, just as far as like a pre-op or review, MRI review, and he started explaining based on the x-ray that what's wrong with those two levels and what type of pain I feel or I should feel. And it was exactly how I felt in the different level he was talking about. And he immediately, I have that trust because I haven't even told him what's wrong, what I experienced. The second day after surgery, I start moving around. They told me don't lift anything heavy, and I try, and it wasn't hurting me. And you know, I was very excited. I was happy after almost 2.5 years. I'm able to, you know, do this stuff, and I'm not gonna constantly say I'm in pain, I have headache, my neck hurt. It was a big relief. I do stuff with my daughters. When they want to go to the mall, they want to spend time with me. Now I'm able. It's not like, okay, let's see how mom feels this weekend to plan anything as a family. Me and my husband, we go to function. We just had our 25th anniversary. We went with some of our friends to cruise. We do things, we go dancing. That's something I have a hard time to do because I couldn't move. I couldn't be in my feet for that long without, hurting myself or feeling in pain. Now we, participate in the functions, and even my marriage is better. The experience I have, it was a wonderful experience, and I suggest it to anybody have any problems, spine problem, contact Bonati Spine Institute. They are so friendly, and they welcome you. You feel like they known you, or you are their friends or best friends. That's how they treat every patient walk through the door. So you feel like you're home. You're not in the institute or outpatient surgery center. You feel like family. They take care of you, and you'd be amazed how quickly you feel relief, and you regretted that why you didn't contact the Bonati Institute earlier. Don't wait. Don't wait like I did, because it's affect your family, and you losing a day of spending a good quality life with your family, with your friends. Don't lose that moment with your children. If you have a young children and you're in pain and waking up every day with the headaches related to your neck, don't delay it, because one day it passed, it's going to be a week, it's going to be a month, and then you're losing that time with your family, which you cannot get back.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done, and we can correct that.
The procedure I have at the Bonati Spine Institute brought the life and the light back to my life, brought my family together again. We are, as a team, we are together, we love each other, and now I can enjoy my family. Do it now. Just pick up the phone and call. It's a free, it's no charge to anybody for consultation, and send your MRI, send your report. And if you're a candidate, you can make an appointment and make that trip to go. It's worth it.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
When I first met him, and he reviewed the MRI, and was, while reviewing the MRI, was saying, you have a problem here. That gives you pain. It should have pain here. And it's like, well, exactly. Well, I've had a lot of people ask me about my back. And when I explained to them that I'm virtually pain-free, I have recommended, since my surgery, 3 people to Dr. Bonati. And my comment to them was, it worked for me. You need at least a consult. Get an MRI, get a consult, and then you make your decision from there. So anyone that had pain like me, I definitely recommend the Bonati Spine Institute.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
In our final segment, Kimberly had a chance to talk with Dr. Bonati about how many doctors have a negative view on Obamacare, as it affects every aspect of their practice. You may be surprised if you ask your own doctor how they feel about Obamacare. Here is Dr. Bonati's opinion.
You know, on this show, we always promote new medical advancements. We talked about cool sculpting, the doctor that did the TMS therapy for depression. Earlier in this show, we spotlighted ReWalk, that were the exoskeletons for those that were paralyzed. Why is it so important to continue on that path of medical advancements?
Because the normal type of a decay of a human through years require that the human will have some type of a help to heal their own problems. For example, in this last year, we have a tremendous advances in medicine. The problem is Obamacare. The medical community and the research community is being attacked by Obama ideas of how to deliver medicine to the country. We are going to also delay the advances that they are coming in the near future. The medical advances to watch are, for example, recently they discovered a bionic eye. They create a computerized system that is being placed on the glasses of the individual, and this is the beginning. So they put these glasses in the individual who is blind, and those glasses go to a type of an antenna that is being placed inside of the retina of this individual, and you bypass the damage on the retina and goes directly to the optic nerve.
So Dr. Bonati, why is it that you, a single doctor that runs his own practice, is the one that's highlighting these new innovations? Why isn't the government out there and backing these new technologies?
I don't know if we are fair or unfair with the government. I think some of these products are being sponsored or being paid by grants and things like that. But you know, the real truth is anything that is managed by a politician or anything that is managed by a government is only a mediocrity, a lack of responsibility, expensive. We need to get back in medicine to what doctors were before. We need to sponsor our own products. We need to deliver our own ideas, and we need to expose the things that we can do to the citizen who can become curious about and ask the right questions, and corporations to participate and create these new things.
But what knowledge do they have to be able to manage medicine?
Well, the problem is the doctors. The doctors are too naive, too passive. They don't want to participate in anything that is make noise. They want to be on the backside of the problem.
But why, when it affects their livelihood, would they be that passive?
They feel that if they don't make any noise, the thing is going to blow away and they are going to continue doing their normal life. What they don't understand is every time that the law is passed against medicine is one restriction more to you practice good medicine. Correct. For example, the government is pushing very strong now to this Obamacare. But Obamacare is a bad joke. The next thing that you're going to be the doctors is writing millions of documents to satisfy the politicians and individuals that they are going to be regulatory systems and lawyers. And then you're going to end with that one with a horrendous amount of expenses, bad result, bad medicine, and doctors probably that will be losing their license because they're going to be accused of corruption or fraud.
If a doctor does start off seeing a patient like this doctor claimed, and then they have to just be uprooted from that, brought to another facility, see another doctor, is that doctor really getting the entire picture of that patient?
No, it's the typical European medicine. They get one individual who's sick to a GP, and the GP goes in full with that patient as far as they can. And when the patient is almost in a situation of a disaster, then they send that thing to a specialist. The specialist is probably very, very busy. So before that patient is going to be attended, it's going to happen to what happened to the veterans in this country. Before the veteran was seen, the veteran died.
Well, Dr. Bonati, you know, not only do we have the television program, but also our radio program, and we have so many doctors on that seem to mouth everything you say, and they are in total agreement that Obamacare is truly one of the worst things for Americans.
Well, it is, and they are right. The only problem is that they need to wake up. They are welcome to come to the program anytime that they want to voice their opinion. This is their forum, and this is open for them. I'll shut my mouth anytime that any one of these doctors want to come over and take over and talk about, because they are affecting the life of my patient, and that is what I'm looking for.
And on that note, we're going to hear some of the comments from those doctors themselves. Thank you for watching American Medicine Today. If you have any comments or questions, please feel free to contact us at the number below. When you do, make sure you leave your name and your number. Otherwise, tweet at Dr. Bonati or hashtag American Medicine Today. We respect your views and opinions and would like to hear from you.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The preceding program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.